what you...
Thank you very much, Ruben, for this opportunity to speak with experts in the field like David Navarro, whose introduction was very useful to all of us, to the ministry staff, to our audience. And thank you for this opportunity to introduce what we have now in Armenia. Actually, I've written down some points to go through, and I think it's very important to start from very beginning, because we, as a Ministry of Health and then as a government, started to concentrate our attention to this issue from mid-January, and because we had very specific challenge that the visa-free regime for Chinese citizens went into force just when the outbreaks started in China, and we had to act very quickly to restrict the potential entry of the virus with the Chinese citizens into Armenia, and we acted very quickly and just stopped this visa-free regime, and which I think allowed us to have a lot of time to get prepared for the cases in Armenia. The same is done with Iran, and which are our closest neighbor, and even Dr. Navarro emphasized the case of Iran as an exceptional before Italy, actually. And we had to act very quickly, and we succeeded, I guess. The whole government mobilized their resources. Decision-making processes are done very quickly. We had even actually adopted a government decree that interagency body created in the in the end of the January, which coordinated all the things through now. As of now, I would say that the first case was diagnosed in the 1st of March, but then we had a kind of grace period for the second case. The first case was from Iran, and the second case and the third case was from Italy. And after the second case, we had growing numbers of cases because of the local transmission. And now as of actually morning, for Armenia, we have 372 cases, out of which 28 are healed or recovered or virus-free, we can say so. And we have one fatality. What we do now as anti-epidemic or pandemic measures is mainly in line with what WHO and UN and international community suggest. This is a limitation of movements of people. Actually, the country is under lockdown, total lockdown now for a period of week, but it can be revised, like to have more, to extend for a week or so. We have a system in place for testing of the suspected cases, tracing the cases, isolating the contacts, mainly in the special cases like hotels or so, self-isolating of second contacts or people that travel to Armenia from the risk zones. Like the number of countries is now very big, actually more than 20 countries, and the list is getting more and more extending. Yeah. And the treatment, of course. For the treatment, I can say that we try to use the drugs or methods that are actually not totally evidence-based, because we have very short time to justify everything, the international scientific research community. But we use the chloroquine, we use the antiretroviral drugs, from actually a week for a period of week or so, and we will have our own results soon, I guess. The second part for the treatment is that we are actually creating a branch in the health system to deal only with coronavirus. We are mobilizing either abandoned or not fully loaded hospitals just to deal with coronavirus with beds. We are mobilizing about 700 beds for only coronavirus, with about 70 to 80 ICU beds, which also can be extended to a bit more. Of course, we face lots of challenges, starting from personal protective equipment that we have insured, and actually all countries now insured of this personal protective equipment. But this is very keen and very crucial to break the transmission cycles, because if medical doctors, like in Italy, or nurses get infected, they transmit the disease in hospitals, and the people who are sick and who have chronic conditions, or our elderly citizens can get infected, and we will have, actually any country would have lots of fatalities. So the personal protective equipment, I think, is more important than even having ventilators in ICUs. Because if you have like hundreds or thousands or even tens of thousands cases, I think any healthcare system cannot handle, no healthcare system cannot handle this cases, this number of cases. So we try to buy PPEs from mainly from China, but also everybody, as everybody knows, we have lots of logistic programs, because flights are shut down to the lots of directions. The land transport is very slow, plus lots of land borders are closed now. Actually, all our land borders now are closed, except of course for cargo, but again, there are limitations for cargo too. For instance, if the driver of a truck has a high temperature, he is not allowed to enter the country, to Armenia. So we mobilize even our air cargo resources to have charter flights from different countries for PPEs and equipment, plus charter flights to actually evacuate Armenian citizens to Armenia. For the international support, of course, we started to involve our all international partners, starting from UN agencies. This is mainly, of course, WHO, European office and Armenian office. UN, other agencies like World Food Program is trying to help us to get some PPEs and equipment, tests, of course, the tests too. I would refer a bit to tests. We use only PCR tests and try to stick to them and have more capacities to do PCRs, and we try to avoid rapid testing, as our specialists suggest that they are not very specific and sensitive. And we see now the international media reporting that several countries failed to introduce this testing, like screening for systems, because of the flaws in the tests, mainly again coming from China, Spain, our neighbor Georgia, and we try to increase our capacities only for PCR testing. It is very difficult, it is very expensive, but it is very correct, I guess. And for the other international support and coordination, we work very closely with our neighbors countries. So except from the transnational organizations like UN or WHO agencies, we try to work closely with our neighboring countries, with Russia, from which we get lots of support, mainly for testing equipment. with China. We work very closely with China, and we see that China is trying to help more and more countries. And using their technical experience, how they did, how they succeeded, plus using their capacities to provide the PPEs and equipment. Of course, Armenian community and Armenian diaspora also helps us mainly from US, and we are continuing to these efforts to see how they can continue to help us. Though we understand that US is now another burning point or area in the map of the world, but I think that this cross-country or cross-national support can help nations like Armenia have face this challenge with less damage, I guess, because now we are in the phase of damage control, something like that. And for the economy and for the health system particularly, and for the spread of the disease. So again, just summarizing what I've said, we do stick to the proposals from the WHO and other international partners to find suspect cases, to test them, to trace them, to isolate the contacts, to treat them, and break the transmission cycles as much as possible, and hoping for the vaccine and for the specific treatment to come out. Because as again Dr. Nabarro stated, there cannot be an expectation that this will end soon. We have to get ready for the long-term interventions, and all governments actually have to do this. And I can say that Armenian government understands this that this is not an issue of one or month. And we have to be ready for these long-term interventions. I would be very happy to answer the specific questions if there are.
Thank you. Thank you. Before we're going to the next panel and come back to some question, I want one more question about the volunteers. We heard in many countries people willing to support, because today the main message for all the society saying stay in home, behave correctly, try to keep the rules, don't violate the private, again, try to follow all the rules. And this is the only way you can help, the best way to help. But there were a lot of volunteers. We heard about 400,000 people in UK. We heard in Armenia was 2,000 people. And we also know it's one of the issues about not enough places to put the people with quarantine, not enough nurses, not enough medical service people. Do we see any programs of short-term education program where we can help people be educated and help support the infrastructure? Because we saw in Italy how the medical people been basically working 24 hours, 7 days a week, and getting a lot of by infections because of the too many pressure to them. Do you see the volunteers can help some way to decrease the pressure, or it's not realistic?
Thank you. It's a very good question. Actually, we have two kinds of volunteers. First type of volunteers are those who can help with logistic, with paramedical support, let's say so, that we have now, and we have several thousand people that sign up for this volunteering, and we try to select those who are in the age and condition that are less risky for them to get involved, not to harm them, and then to provide some very basic training for epidemiology issues, how to protect themselves, how not to get infected. And the second type of volunteers are medical staff, actually, that are not dealing with the infectious diseases or epidemiology in general life, in their general working life. And we mobilize them to retrain, actually, as doctors or as nurses who can deal with patients with coronavirus. And so far we have trained about more than 100 of doctors and nurses for a short period of time, like for 3 or 4 days, with the basics of epidemiology, how to protect themselves and how to approach these patients. And second, the basics of like pulmonology and infectious diseases that can be a substitute for those doctors who get infected. And it's very pity for us, but we have now several, actually, a nurse and a doctor from an infectious disease hospital that got coronavirus. And also we have lots of elderly doctors and nurses that should be, actually must be substituted as quickly as possible, not to put them under the danger. So the volunteering, of course, and mobilizing the volunteers is one of the main directions to provide the continuity of the service, because medical staff is warning out, or actually warning down, I don't know the exact, yeah, yes, thank you.
Thank you.